dentistry is not comfortable. If your patient wants to be comfortable, give them the razorpan. Now I'm using plaque indicating dye here. The dye is to show plaque, not caries. Okay, if you want to use caries indicator, it's probably the same stuff. But I really want to know how to get the plaque off. This is an AquaCare, so I'm using aluminium oxide. I don't use the polishing thing so much because I'm in a hurry and I really want to clean things quickly. So then you want to try, but instead you just cut it out and do it again. Now you can see there that I am kind of using the microbrush to drag the composite to the margin, and that's how I remove the excess. So if you have excess composite, you just kind of pull it towards the margin. Okay, now the disc is on backwards, so I've put it on the mandrel backwards. Excellent for getting those excess bits off on the back of the lingual. Now I know some people have their matrix band so perfectly adapted that they never get excess. I'm not one of those people. I'm just kind of ordinary like you. Using my 12 to take off the excess.